Good evening, listeners and viewers all over the world, wherever you are tonight. This is Ashford, Garley live on British Radio Africa. My name is Volcano Shelton, the co-host of the program. Ashford did tell you that I was going to be here going solo tonight. And so I just want to welcome all of you, our avid viewers and listeners, wherever you are. Welcome to the show. Unfortunately, we're not coming on 8 o'clock tonight because we did say in our promo that we had some uncontrollable circumstances that led to this. So we want to hope that you will come on tonight, join us wherever you are. If you're celebrating your birthday today, we say happy birthday to you. Those of you who celebrated Valentine yesterday, I know it was a wonderful time for all the lovers. We say keep the knot tied, and continue to hold on to your love. We want to say if you're celebrating an anniversary, we also want to wish you well as you celebrate. We look forward to having a lot of you here tonight. The conversation is going to be great. I have two important people here in studios tonight, practitioners, experts who will be discussing medical issues in Liberia. You and I know the problem is always, we have said over time, people are being misdiagnosed. Is it because we don't have the right medical equipment to do that? Or are the practitioners themselves not skilled enough? Or don't we have the right facilities? Because sometimes, if electricity is not in place, how do you go ahead and do your job? So there's a whole lot we'll be covering here tonight. And I just want to welcome all of you. Ashford, hope you're having a great time as well, wherever you are, picking up signal if you are. We say welcome to the show. Okay, this is British Radio Africa right here with Ashford Garley live here on YouTube and Facebook. You can catch us on both of our channels. We want to say thank you to our sister radio stations relaying our broadcast in Liberia. 105.3 Top FM in Grand Jita County, that's in Zwedru, Grand Jita County. Live FM 104.1 and Joy FM 101.5. We want to say thank you guys for carrying our broadcast. It's important that this platform goes as far as it can go, especially in Liberia, where a lot of our people would benefit from what we talk about here. So tonight, as I said, we're going to be discussing health issues here, and it's important. So our promo did say that proper medical diagnosis remains an existential problem, particularly since the end of the civil war in Liberia. With continued misdiagnosis, many people end up dying, and could this be due to the lack of up-to-date medical equipment, poor healthcare facilities, or the inexperience of some of our practitioners in the country? So I have Dr. Moses Ziah II, who is a Liberian physician currently working at the E.S. Grant Mental Health Hospital, John F. Kennedy Medical Center, as the chief resident in the Department of Psychiatry. Dr. Ziah is a graduate of the A.M. Duckley of the College of Medicine and currently serves as the Assistant Secretary General of the Liberia Medical and Dental Association. Dr. Ziah is also a lecturer at the Mother Patent College of Health Sciences and runs a voluntary health education program called Health Talk with Dr. Ziah. It's a television and radio broadcast that comes on KMTV Hot FM 107.9 and Radio Advent 93.7 FM in Liberia. Dr. Ziah, we want to welcome you to our broadcast. Thank you so much for making time to be here with us tonight. Ladies and gentlemen, this is the young medical doctor in Liberia. I was so impressed when I saw him. I'm like, wow. So, everybody goes to the University of Liberia. They want to study political science. They want to study sociology, and they want to study now the new trending career is public administration. So, welcome.
Good evening, Mr. Shelton, and good evening to everyone. Good evening from my end. In fact, it's almost
It's
midnight.
nighttime.
So, yeah, good evening to everyone, and I'm glad to be on the platform. Thank you for inviting me out here.
Thank you. Thank you. And our next studio guest is Dr. Bartum and Kulah, who based in the U.S. Out of Atlanta, Georgia. Dr. Kulah, welcome to the show. I will give you a minute to tell us a little bit about you before we proceed with our discussion tonight. All right, I see he kind of gone. Okay, he's
I'm
back.
sorry, we're
All right,
dealing with technology here.
okay.
Good evening. I'm Bartum Kulah. I'm a resident physician in family medicine. I also have an MBA in healthcare management from Auburn University. I currently work as an independent contractor as a medical science liaison, mostly doing medical research, setting up research, healthcare research for family practitioners, and following up with key opinion leaders, as we call them, in the healthcare industry. So that's me in a nutshell. I also help with Health Page Liberia Inc., a facility that my mother-in-law runs out of Liberia, where we transport pediatric patients to America for medical care.
Thank you very much. Just before I come back to you, gentlemen, I want to welcome Melvin Dix, Raymond S. Clark of Texas, Myron Sandy, Charlene Dunbar, uh, and Joe Williams. We hope that share the link, share the video, so that more people can come on tonight because this is a very important, very very important discussion here. So, Dr. Zia, Dr. Kula wanted us to have a balanced perspective on the discussion tonight, and he was very instrumental in getting you to serve as our guest from Liberia, so that this discussion can go very well. But you're more in Liberia, and so I'm sure that you are familiar with the health issues trending in the country. Um, First, I want to know what's the relationship currently with the ES Grant Hospital and the Ministry of Health and that of the John F. Kennedy Medical Center, because it seems as though you're between those two medical hospitals. Are you there?
All right, and am I coming clear?
Yeah, you kind of froze a little bit. Come in.
Yes.
Good.
Sorry about that. Okay. Thank you so much. Like I said earlier, it's a pleasure to be on the platform, and it's a pleasure to share what I know about the situations and about the topic we want to discuss. I work as a psychiatric resident at the ESG Mental Health Hospital, which is a component of the John F. Kennedy Medical Center. It's one of four components of that institution. And as you may know, JFK is a semi-autonomous agency. It is the National Referral Hospital in Liberia, and it works definitely with the Ministry of Health. Okay, so my role as a psychiatric resident at the ES Green Mental Health Hospital is to mostly, treat patients who come in with mental health issues. And being a part of JFK, there's a link. I mean, link.
Go ahead. I'm listening. Go ahead.
Yeah, I mean, there's an obvious relationship, but it's more administrative. And as you know, I'm a clinician. I work as a medical doctor, so I stay put on the medical issues.
Thank you. We had a discussion a few nights ago regarding mental health, and Dr. Kula came in and chimed in that night, and we hope that when we resuscitate this conversation again, hopefully you can come, to lend us your expertise, because we were discussing that topic prior to coming into this topic. Um, but let's talk about the issue of why we're here tonight, and I will give Dr. Kula the chance to come in, but I want you to come in first. Um, Misdiagnosis in Liberia is now the issue. What do you think are some of the reasons for people being misdiagnosed, and by the time they get to know, it is late?
Okay, misdiagnosis, you're very right. Misdiagnosis is a problem in any setting where the healthcare service is not up to task. In any setting where you have limited investigative modalities, in any setting where you have, challenges with diagnostic equipment. So for sure, yeah, it is a problem in Liberia, and perhaps that will improve, but at the moment, it is indeed a problem. You can think about it this way. Look at the entire healthcare sector in Liberia. We have the urban health setting, and then we have the rural health setting. Now, most of the major hospitals in this country are run by the government, so they are public facilities. But of those public facilities, we are in the city in Monrovia, so JFK is the major one. In the environs of Monrovia, there are other, tertiary hospitals. They should be tertiary hospitals, although they're not national referral hospitals, but they are around. Like the JDJ, for example, they got the JN Davis. So there are other hospitals that are around that are also serving. But you can imagine if the national referral hospital is still not up to tax with investigative modalities at the moment in 21st century care, then you can imagine the trickle down effect at the other facilities. So even in Montserrado, in Monrovia, in the city, there are still challenges with investigative modalities. The story is changing, by the way. It is changing because there has been, there has been efforts over the time that has improved the situation compared to what it used to be. But of course, I will still indicate that yeah, there are major gaps in terms of diagnostic modalities. So misdiagnosis rather will be an issue when you don't have appropriate or optimal diagnostic modalities. So if we're discussing at hospital level, then you can imagine what's happening at clinic, at health facility and clinic levels. And the fact that there are lots of, private clinics that are just interested in, you know, the finance is more like commercial, is a business stuff. So people only try to do what they can do to get what they can get. So you can imagine that if even national and national referral hospitals and tertiary hospitals are struggling with investigative modalities, that is for certain that those local facilities are struggling as well. And in the midst of, poor diagnostic modalities, of course, misdiagnosis is the outcome.
So then, Dr. Kula, he said something here, leaving from the higher hospital that's already struggling, and you have all of the little small clinics, in-home clinics, some of them run by CNAs and nursing aid and all of that. Will you say that then we support the thesis that some of the practitioners are not skilled enough to even do diagnosis?
Part of it is the fact that some of the practitioners in the community, like nurses aides or nurses or PAs, uh, are doing things that they shouldn't be doing, or people are going to them and not knowing the scope of what they're able to do. I think there's a lack of information in the country about healthcare. For example, if we had a situation where and we told our people in a situation where you're short of breath, you ought to go to JFK, for example. Don't go to your community clinic because they don't have equipment to resuscitate you, or you have certain chronic cases, do not go to the medicine man, because the first thing our people like to do is to self-medicate. So they either go to the medicine man. If the medicine man doesn't work, go to the prayer warrior. By the time you get to JFK, it's too late. So we have to have a way of informing our people about how to acquire health care. Where do you go for the type of the type of symptoms that you're having? I think that's one of the key things that we need to do is inform our people, have PSAs, public service announcements, to inform our people about health care and about their health and what to do and where to seek care. I think that is very important to do.
But then that brings to mind the question that some people are very afraid to go to the hospitals because the hospitals charge so much money and they may not afford it. And that's why they, kind of go to the people in the neighborhood to get treated. And I don't know of any free healthcare in Liberia. So, and even if it's free healthcare, what we're hearing, and I was hoping that the doctor comes back. I'm sure he's trying to get reconnected, probably his internet or so. But what we're hearing is that people are being held hostage at John F. Kennedy Medical Center. After they're treated and can't pay the medical bills, they're lingering all in the corridors. They can't leave until they make payments. So when you hear that kind of story, you get afraid to even want to go, to the doctor or to the major hospital.
What's interesting about that whole thing about holding our people hostage, I remember when President Weah first took over, he indicated that he would do something about that. And I think they even raised some money at the foundation where they were supposed to release certain people. Then there's a case where a lot of our legislators indicate to our people that healthcare is free at JFK. So I think JFK needs to do the proper thing of coming forth and letting our people know what is required of them. Do you pay a certain fee, to register, or do you have to pay a certain amount of money for certain services, or is JFK free? Because if our people don't know what is required of them, like you say, they'll go to the average man in the community because they're afraid that they'll be held hostage after they're treated. So we have to do something about informing our people about healthcare, or even get to the point where we create a health insurance scheme for the majority of our people. I think that's a key thing that we need to do as well.
So there's a lot of mispriorities here in Liberia when you come to think about it. Say, for instance, you're talking about the John F. Kennedy Medical Center. I see Dr. Ziah is back. Good. Dr. Ziah, let me quickly add you in studio. Good. You're back. So we're just talking about, I don't know if you were following the topic, the discussion, but we're just talking about the issue. Can you hear me?
Yes, I'm hearing you.
We're just talking about the issue of people being held hostage at the John F. Kennedy Medical Center after they, get treated and they don't have the money to pay. But we also know that some of the issues at the hospital is that people who worked at the hospital taking the medication and things into the community to open their own little makeshift clinics in their homes. Do you know anything about this? Is this something you want to touch on?
Well, being a physician and a clinician, like I said earlier, I stay put to medical related issues. There are administrative issues in in every entity. Now, this concept of people taking away drugs to the private facilities, I'm definitely not going to vouch for anybody to say they do it or they don't do it. In my experience as a physician practicing, I have not experienced it personally to see someone doing it, right? But I also wouldn't say it doesn't happen. I can't say for sure. But there are always vices in all of our areas, in all the settings. There are vices, and maybe these are some of the issues. But administrations are working harder to make sure these things are curtailed, even if they're happening. And the administration of John F. Kennedy Medical Center is for sure one of the administrations that I know have been working exceedingly hard to improve the quality in terms of service delivery, in terms of provision of needed services, in terms of supplies and everything. The administration has been working a lot, all right, and I know they've been improving whatever system they met in place. But I wouldn't say for sure that it is not happening or it is happening. Now, one of the issues, I don't know where exactly you were with that conversation, but one of the issues relating to patients not being able to afford bills, well, we in Liberia know that the economic situation is just getting challenging by the day. And the truth is, medical care, medical services are not cheap. Not anywhere in the world. They're not cheap. But in Liberia, there is this system, unquote, free service in most of the facilities. And we as Liberians have grounded our thoughts in those concepts that we should get free service at a facility. So because of that, we go to the hospital most of the time expecting that we shouldn't be paying, or at least we should be paying very minimal, fees. But then again, beyond the facility, government is stranded. Government doesn't have enough fund, at least that's what we hear, to support these facilities. So you realize that although the service is free, unquote, in most of the private facilities, the truth is patients are actually paying. Now, JFK is a semi-autonomous agency. It is not part of the health facility that is free service, unquote. JFK collects fee for service, all right. Although compared to other, hospitals, other private hospitals, JFK's fee is lower, all right. But of course, JFK collects fee. Most of the other facilities, including Redemption Hospital, the Phoebe Hospital, and most of these other hospitals, the concept is that it's a free service. But truly, it's a free service, but none of the equipment, none of the drugs are available to do anything. So at the end of the day, the patients actually buy medications that ought to be free because they're not available.
Okay.
You know,
So I'll quickly ask you, what are some of the different departments within the John F. Kennedy Medical Center where diagnoses are being done, and the kinds of equipment and the specializations of the practitioners, be it the medical doctors? It could be an OB/GYN, it could be a heart doctor, it could be a cardiologist, what so if I came to Liberia and got sick and I went there, I want to have the right diagnosis because I trust that GFK can provide that.
yeah. Okay, so let me be quick to point out that I am just providing information um, obtained from a personal experience working in the system. I am not an administrator, so I wouldn't speak in the capacity of one.
Thank you.
Okay, I'm
Thanks a
not
lot.
a politician, I'm not a government official, so I wouldn't speak in those capacities. I'm a clinician, a medical doctor, and I've experienced those things, those information I'm providing, I've experienced them firsthand, so I would definitely provide that. JFK Medical Center is the national referral hospital. It is the first hospital in Liberia. Back in the days, long before some of us were born, we know, we have heard, we've understood that it used to be a premier hospital in the region and even in Africa. But throughout the course of the war, a lot of systems were broken, a lot of infrastructures were destroyed. And so back to recovery, it has been a process. It has been a gradual process, which has actually been improving eventually. And I can clearly say that. Okay. JFK in general has about four components. There is what we call the Memorial Hospital, and that Memorial Hospital includes all the other departments, including surgery, internal medicine, pediatrics. Okay, and then we have another component called the Maternity Hospital. Is the Liberal Japanese Partnership Maternity Hospital. It is in the same compound, but it is a separate facility where OB/GYN services are provided. Then we have what used to be the Catherine Mills, which was the mental health facility at the time, but it got destroyed by the war. Now it is the E.S. Green Mental Health Hospital. Now, E.S. Green Mental Health Hospital used to be a private run facility, but the physician who owned the facility passed in around 2010. That facility was passed on to JFK. So there where mental health services are provided. And then the fourth component of JFK is the Tubman National Institute of Medical Arts, the TNIMA. Is a school, all right, teaching paramedical, courses, nurses, midwives, physician assistants, and so on. So those are the components. At the moment, when you talk about where diagnoses are made, all other departments besides, all the other components besides TNIMA, because all the other components are hospitals. So the maternity hospital, the memorial, and of course, the ESG mental health hospital. Speaking of the services that have been rendered, truth is, services have increased. The quality of services have increased remarkably over several years now. Although we are not at the top, we're not at where we want to be, but we are somewhere better than where we used to be, for sure. Okay. Now, speaking of infrastructure, there has been a progressive increment over the years. And I will tell you, just about anywhere around 5, 6 years ago, there was no modern imaging suite at JFK. There was no way to do CT scan. There was no way to do MRI. There was no way to do, advanced digital um, ultrasound, or even X-ray. Most of these things were not available. At the moment, we have a modern image suite. All right. MRI is currently not functional, but I think it's being processed. But CT scan is available, and we have other new facilities added to the services being provided. Okay. We have, for example, we have the eye center. It was added a couple of years, some years ago. We have a modern eye center now at JFK that is being run by some Indian partners. Okay, and they are at least they are providing 21st century services. So they bring in their consultants, they bring in their machineries, they bring in their equipment, and they are providing quality services at the moment. The other facilities, all the other departments in the hospital are well equipped with very trained practitioners, courtesy of the Liberia College of Physicians and Surgeons. So, they for the first time, postgraduate medical education was introduced in Liberia in 2013. So you can imagine, prior to that time, we had a lot of general practitioners who got maybe apprenticeship training in specific areas, got specific skills in specific areas, and then at times there were consultants who were around, few consultants. But the inception of the Liberia College of Physicians and Surgeons, which is the postgraduate medical education in Liberia, created the avenue whereby trained practitioners, consultants in different disciplines, and specialist physicians became available to provide services. So they being available was a means through which they were training, resident doctors, residents in different disciplines. So in terms of manpower, in terms of health workforce, that was a major boost. That was a major boost. And at any given point in time, you have multiple consultants in every department. So of course, that is a major boost. But when you have the health workforce without all the needed equipment and diagnostic modalities, you also know that there's a trouble right there. All right. So truth is, there are still challenges.
So we
Can we
can't.
get
So we cannot blame unskilled practitioners misdiagnosing. So we
Go
should
ahead,
just
sir.
deal with the equipment and facility. Dr. Zia?
Moment, and I wouldn't make. Sorry. Yeah. Okay. Sorry. Am I back?
Yeah, you were frozen. Did you get my question?
Yes. Yes, I got it. So I wouldn't make a general statement for sure. So when we talk about misdiagnosis, it is a national issue. So you know that
Which
we
could be a
speaking,
conglomeration of many things, right?
yes, of course. So we're
Okay.
speaking of the clinic level. We're speaking of health facility level. We're thinking of other, secondary healthcare facility, other tertiary healthcare facility levels. Then we come to the national referral hospital. So when we talk about private facilities, they have what they have, they do what they do. It's commercial, so they will do their best. But their best always optimum? No, for sure, that's not the case. When it comes to misdiagnosis, like I said, our clinic levels and other levels, it may be due to, you know, um, the qualification of the practitioners. Because, for example, nurses and physician assistants and midwives, they can open their own facilities and they can render services. They have limitations though, but they're doing what they are doing. They're doing what they're able to do.
Is
So
that called for? Is
if
that called for? Is that called for in the Liberian medical law? Or because now you one of the people who work, you the assistant secretary general.
right.
Can that be done? A nice opening her own practice?
Okay, so I am the Assistant Secretary General of the Liberia Medical and Dental Association. The association is a conglomeration of doctors who again promote healthcare, seek the doctors' welfare, and all of that. But we have a regulatory body, which is the Liberia Medical and Dental Council, which is a separate entity from the association. That entity regulates medical practice in Liberia. They have their guidelines, they have their rules, they have, reasons why they certify people to provide
But,
services.
but I believe that I believe you guys came together for the welfare of medical doctors and so forth. So
Right,
if you have people who are less educated or don't have the requisite or required education to open their own practices, then that puts a tint overall on the medical well-being of the country. And this is
that's
where
correct.
you will come in as an association to fight for, making sure that the regulatory body is doing what is right by the medical field.
Right, that's very correct. So, like I was saying, for LMDC, which is the council, they have guidelines. They have the accreditation guidelines for clinic, for health facility, for hospital. So they have those guidelines. And one thing I should register is there is no healthcare facility, whether clinic or not, that is open into that is open in this country without a covering medical doctor, a
Okay.
current practicing licensed medical doctor. So it means that all the clinics in Liberia operating, all the healthcare facilities, there are medical doctors that are supervising the services they run.
So that means I can come to Liberia and decide to open my clinic, but I must have a medical doctor. I don't have to be in the medical field to open a clinic. Once it's my
Right.
passion.
In terms of the health workforce, in terms of the staff needed to open a facility, LMDC has a requirement, a criteria. Once you meet that criteria in terms of all the different areas that they are requesting that you meet, of course, you can get a facility. But again, I wouldn't speak much about the criteria because I I am not a part of LMDC, the council, and I therefore cannot provide information as to what they do or what they don't do. But I do know for sure that there are set criteria for people to open healthcare facilities. One of which is for a medical doctor, a current practicing licensed medical doctor to cover such facility.
Thank you. Dr. Kula, let me come to you. He did mention that he has some kind of trust in the system now, and there's been a lot of improvement. But when we look at the overall health picture of Liberia, the government officials in the country themselves don't even trust the system. Vice President runs to Ghana. Uh, the late not foreign, public works minister ran to Ghana. Yeka Koluba was sick the other day. Honorable Yeka Koluba ran to Ghana. So how then Dr. Ziah is so confident that the health system in Liberia is improving. It may not be up to par to the international world, but at least it's improving enough for our government officials to be the ones trusting the system, going there, so that the people can trust the system, and you and I can do the same. Especially those of us who travel from abroad and go to Liberia and we get sick, we want to be able to trust the system rather than fighting to run back to America. What do you make of this?
Well, I think what Dr. Zia is saying is that compared to where it used to be, it's gotten better. And he mentioned the college of physicians and surgeons that are specializing or training specialists right now. So in that regard, it's much better instead of just having a bunch of practitioners. The other thing he raised the fact that there are more diagnostic modalities. Like for example, you have Jamalik Clinic that has all these diagnostic modalities, CT scans, and you can do all these lab work, scans, and so on and so forth. So in that regard, for the average Liberian citizen, it's become better. But for our officials and for those of us that travel from the U.S. and other parts of the world, it's not yet up to standard. What you would call a standard of care that's commensurate with first world standard of care, or even our standard in Ghana or South Africa. And because of that reason, our officials go abroad. And I think we need to get our healthcare delivery system to where it's at least commensurate out of Ghana or others in West Africa, so that our people don't have to go outside for every little thing or even for major emergencies. We ought to bring, for example, our emergency room at JFK to a top-notch emergency room that can save our people in cases of trauma with all the pimping, all the bad accidents. Save our people in cases where you have somebody has a stroke, somebody has an aneurysm, like what happened to Mabutu Nyempa and all these other officials and other Liberians, common Liberians and average Liberians that have died unnecessarily, like Mamadi Diakite or like mother who died of shortness of breath because we didn't have a ventilator at the JFK ER. So we need to bring up, and I think they're trying to bring things up to standard because I understand sooner or later they'll have dialysis. We don't have dialysis in Liberia, you know. So I think the president and those officials who are still going about, if you can bring our system to at least a standard of that of those in West Africa and bring confidence in the system where you go there and get your health care or your checkup annually so that it boosts the system. It boosts the morale of those who work in the system. And it also helps our people in Liberia to have confidence in the system. I think we need to work hard. The other thing we need to do is have a coordination of care. Our people go and seek care, and after they're treated, going back. So they're lost to follow-up, and most people don't have checkups. We have to find a way that our students can have annual checkups before they get into sports and before they go to school. People that work have annual checkups, have at least a baseline medical physical so that if anything happens, you know what your past medical history is, you know what you're allergic to, so you don't give those medications without asking them what they're allergic to, and so on and so forth. All of those little things we need to patch, and we need to the example of Cuba, where because they didn't have certain things, their primary prevention, primary health care is strong, so people are healthy. So by the time you get to something major, you already caught it early and you can do something about it. I think we need to work on those things as well.
Now, Dr. Zia, you did mention that you're not in the administration arm of leadership at JFK, but at least based on your knowledge, say I came to Liberia, is everything got to be cash for service? What if I were to come with my medical insurance from here? Is it transferable? Will it be accepted? Because some people will be thinking that way. Because just the other day we heard no money in the bank. And if I got sick and I have top-notch medical care here in the U.S., I should be able to come to JFK and say, listen, here's my medical card, but you got to treat me. I don't have any money right now. Is that possible?
Well, I'm quite unsure of that. I don't think it works at the moment. Unfortunately, we have to transact with cash or maybe point of sale cards, maybe, but mostly cash. Clearly, mostly cash.
Let me interject in that area right there. I think Johnson does accept insurance from abroad. If you
Who?
go to their website, it's called Jamale, Jahal. It's a new
Is that a
facility that was
hospital?
open. It's a clinic. It's a clinic. First, it started like a a diagnostic facility, and then they turned it into a clinic. And they have a young lady from the U.S., Dr. Cooper, who is running it, and
Yeah.
they do accept health insurance. And there's another facility called Aspen Clinic, which a lot of the expats use, that accepts insurance. It's one of those clinics that I was instrumental in writing a proposal to help establish. So yes, there are a few that do accept insurance, but the reality is that we have to find a way where our people don't have to pay everything on the spot, where they can make payments. Because a situation happened where a young girl was visiting from the States and she had an accident and she was not treated, and I think the little girl died. Now, there should have been some sort of financial department that could call the family abroad and the family could wire money. We have to find a way where our people don't have to pay everything on the spot. They can pay monthly. They can pay, in installments or something. There has to be a way.
Thank you very much, gentlemen. Dr. Ziah and Dr. Kulah, we are at our intermission. My name is Volcano Shelton here with you on Ashford Garley Live. We're coming your way on Bridge Radio Africa. Our platform can be heard and seen on Facebook and YouTube. We come on Mondays, Wednesdays, and Fridays, 8 p.m. But tonight we're having an exception. That's why we came on 6 o'clock tonight. And we want to invite all of you to continue to follow our broadcast, share the link. We want to grow our following. And today we're discussing misdiagnosis, an issue in Liberia. A lot of people get misdiagnosed, and by the time they get to know, it's late. We want to welcome David Harris, Vani Fifole, Sam Sion, Heinz, Gola King Joshua, Nia J, and also Emmanuel Jackson, Kim Kine, Thomas Adwaji, uh, Shelu Leoria, Undefeatable B. Will, and again, I said Charlene Dunbar. Welcome to the show. Tonight, we're here on Bridge Radio Africa. We also want to say thank you to Top FM in Zwedru, Grangita County, 105.3. You carry our broadcast. We say thank you for the service provided, Joy FM 101.5, and that of Live FM 104.1. The line now will be opened. The number to call is 404-272-2808. If you want to speak with our in-studio guests, Dr. Kulah and Dr. Ziah. Let me come back to Dr. Ziah. Dr. Ziah, you talked about the E.S. Grant Mental Health Hospital. It's a facility and it's an arm of the uh, John F. Kennedy Medical Center. How equipped is that facility as well? When we have thousands and thousands of Zogos out there suffering from mental health, how are we going to clean up? Do we have the space, the capacity to hold people, to treat people, to rehab people, to detox people? Is this hospital comparable to that of a mental health hospital like in a developing or a developed country?
Well, I'll be blunt to say that
And I
no.
like the word blunt.
Yes, I'll be very blunt to say that it is nowhere near what it's supposed to be. Not even for not even for a province, not even for a county. I will say that clearly. Okay, just imagine we have a facility to treat close to 5 million people. All right, in a population of about 5 million people at this time, the only inpatient psychiatric hospital in the whole country with a total bed space of about 60 to 75.
Oh my goodness.
That's
Wow.
thinkable.
Wow.
And a facility on, I think, two lot of land, about two lots of land. It's so below the optimum. It's completely unacceptable. And I mean, those of us who have developed a passion in psychiatry because of the obvious mental health crisis hitting Liberia, we feel disappointed every time. And I can tell you clearly, we feel disappointed every time. We are really, really looking forward to national plans, national movements, national motivation to create an actual mental health hospital. Now, long before some of us were born, we heard of the country mills, and it was up to the tax. It used to be what a mental health facility is supposed to be. At the moment, yes, Grand Mental Health Hospital is way less than a clinic, way less than a personal clinic. I told you before that it was a private practice facility for a doctor, the late Dr. E.S. Grant. He was using it for his private practice. But since his demise, the facility was run a little while by some NGOs, but then later on was turned on to the government, onto JFK, because there is no more catering mills. So technically, there is no more mental health hospital. There is no more private, public rather, public mental health hospital. So that's how that private facility got turned over to JFK, and it's being used as a public facility, but it's way below what it should be. And the entire administration, staff, and everybody working at the facility know that. Everybody else is seem to know that, yeah, this facility is nowhere near where it should be. But again, you just have to do what you have to do using the resources you have. So yeah, we're doing our best to provide quality services to the best of our ability. Now again, I will go back to the Liberia College of Physician Surgeons. About 2 years ago, the faculty of psychiatry was established. So that means long before 2 years ago, Liberia was not training psychiatrists. Just
So we
about
had to
2 years
import them.
ago, right?
We had to import them.
Well,
We had
well,
none. I took one in 2010.
No, no, what I mean, we had to have psychiatrists working at the Catherine Mills Rehabilitation Center. That's what I said. We had to bring them in the country.
yeah. So
Oh,
back in the days, I
Volunteer.
understand there were few. Back in the days of from my professor, I understand that there were few foreign nationals there. And my current professor right now also came to work at the country mills. He worked there for some years before the war, and then he had to leave and go other areas. Then he came back after all for a very long time. For many years, he was the only psychiatrist in Liberia, and that is Dr. Benjamin L. Harris. He was the only psychiatrist in Liberia. All right. About 5 years ago, we got another psychiatrist, Dr. Babawale Ojetiran. He's a Nigerian. So he came on, some other arrangement to teach medical students and also to work at the mental health hospital, which he has been doing diligently. He is currently one of two consultants that we have in country, one of two psychiatric consultants that we have in country. Now, I'm a member of a batch, of the first batch of psychiatrists being trained in Liberia. And we're just two at the moment. And then we have the second batch. So there are at the moment 4 Liberian psychiatrists that are being trained for a population of close to 5 million people.
So since
And
we're
we are
talking
all
diagnosis,
right.
so
We
since
are
we're
all
talking
in
diagnosis,
we are all in a single facility called the ES Mental Health Hospital. For diagnosis, ES Mental Health Hospital is a part of JFK, like I said
and so
earlier.
that's what I wanted to come in quickly to say that what are some of the mental health diagnoses you guys discover as a result of the patients that come over there? And do you have the kinds of treatment to provide from
Well, yeah,
medication to counseling, those things?
yeah. To a greater extent, we see nearly all psychiatric diagnoses around the world. We see psychotic disorders, varieties of psychotic disorders. We see mood disorders, including depression, major depressive disorder, bipolar disorders, and the other ones. We see organic psychosis, people developing mental illness as a result of underlying medical condition. We see substance use disorders, and we see substance induced psychosis, for example. A lot of drug addicts, we are aware they're here. Okay, so we see epilepsy in children, in adults. We see Parkinson's disease. We see dementia. We see, cognitive impairment, impairment disorders. All right. So we see all of these conditions that are seen elsewhere. In terms of diagnosis, because ES grade is a part of JFK, when we need to do specific diagnosis, we send patients to JFK to do, for example, CT scan, EKG, some other things that we want to do, and major blood works like, serology tests, chemistry, all those things. When we need to do them, we send the patients to JFK to get it done and come back, or to any lab to do it and get back to us with the results. Okay, but as a facility, as a mental health facility at the moment, we don't have any investigative modality in the ES Green Mental Health Hospital at the moment. What we have are like these rapid diagnostic tests, for example, malaria rapid diagnostic test. It's just a quick test we do sometimes to treat some of the inpatients. Glucose, random blood sugar tests. The finger prick test, we can do it. Um, the HIV test, sometimes we have straight. The draw urine screen tests, the dipstick, like to know whether someone is using draw. Sometimes we have, sometimes we don't. So internal diagnosis, we work with JFK mostly. In other, diagnostic entities that exist, and then we send patients back and forth. But as a hospital, no, we don't have that. Now, one of the tests, one of the investigative modalities we need for sure in a psychiatric hospital is what we call the electroencephalogram or electroencephalography. We don't have that. There are plenty of motion, courtesy of the training, the postgraduate education. Courtesy of that, there are plenty of motion to get an EEG machine. There are plenty of motion to get an ECT, the electroconvulsive therapy. Those are bare minimum things needed in a psychiatric hospital that we up to now do not still have. So diagnostically, when it comes to mental health specifically, I will tell you we almost don't have anything. We don't
So
have anything. In fact, I
what do
can
you
say
think,
that.
Dr. Kula, could be the blame for all of this? The lack of the equipment. Um, Oftentimes we talk about corruption at all levels in government, but is it just people don't know what are of significance? Because we not a bad mouth the president or anything, but are they missing the priorities here? A healthy nation,
I
a healthy nation is critical to the survivability of a nation. Rather
yeah
than put infrastructure in place, we have a sickling society with lack of nothing. Building roads is great. We need roads. But if we don't have people to be able to walk on those roads, what's the essence?
yeah. I think it's a lack of priorities, especially if as our leaders on the top don't have to use the facilities. If they don't have to use the facilities, they don't care, right? About what the facilities are like. But if they had to use it, therefore they will put the money, into the facilities. That thing is just neglect and not putting our money where we need to put it. We need to make our people healthy, and we need to give our people jobs. And just in the healthcare industry alone, cottage industries could build up around that industry, and it could employ a lot of our people, and it could make our people healthy. But the most important thing about it too is a lot of people, if you think about it, if you list all of the deaths that have happened in that country, could have been prevented if we had put money into our healthcare delivery system. And I think the leadership now is trying, and those of the young people coming up have to also talk about these things. We talk politics all the time, or we talk about building our country. Healthcare should be number one on our list. We should talk about it all the time about building our healthcare delivery system. So every radio station, every political talk show host should be talking about healthcare delivery in Liberia and making it better for our people. Because if our people are not healthy, how can they live? How can we have a vibrant society?
Hello. Mr. Shelton, I'm not hearing you. I'm not sure if you're hearing me.
Yeah, I'm not hearing him either. I think he's
Is this
Sorry,
gone.
better?
I had my mic on mute. Sorry, but are you hearing
Okay,
the caller?
Oh wow.
Are
we
you,
hear me now.
but you are you hearing the caller? Go ahead,
No,
caller.
we're not hearing the call.
All right. Hello, Dr. Kulah and Dr. Ziah. Good evening. Can you hear me?
Yes, we
Yes,
can
we're
hear you
hearing
now.
you. Please go.
Okay. Thank you. Thank you. My name is Heinz Johnson. I'm calling from Virginia. I just want to say, first of all, thank you, Dr. Ziah, for all you do, and I appreciate your great work. Dr. Kulah, you as well. I'm enjoying the conversation. Also, thank you for kind of my sister, Dr. Kulah, is one of your colleagues, the surgeon, Dr. Bartum Kulah in Liberia, and I wholeheartedly appreciate all you guys do. This really maybe a question or a suggestion or something particularly to just look into. On the administrative side of GSK, you being, I think you say you're assisting director or assisting somebody to the Liberia Medical Dental Association. What connection and what are you guys doing to create partnership abroad? Not just America per se, but like I think that the Cuba mentioned places like I'm sorry, it may sound awkward, but Cuba, places like London, other places Luxembourg, those places that have good medical facilities. Are there any preparation or any health administrator in collaboration with the Liberal Health Committee that at the legislators when they make these travels? Put aside Corona right now, all right, it's a major worldwide epidemic, but when they make these travels abroad, they bringing along doctors like you and others to come and make this connection and partnership. One quick example I can say to you, JFK. If you ever make a trip to America, Dr. Zia, or if you ever have the chance of sitting from the Senate or legislature in Liberia to talk about needs and wants, those are some of the things people can do to make connections there with the JFK. You and I were born. JFK was a somewhat a primary hospital then. Now it is trying, but it's not the best. So just wanting to know if y'all can make connection with the Kennedy family or any kind of big hospital in the DC area like Dr. Kulah is working towards. Those things help. And you can take some of the message back when you guys go to board meetings and so because if we depend on the government alone, nothing will be straightened out. You can have the roads where you don't have good medical assistance. It's not going to work. I don't believe you guys can have ambulances in full services and stuff like that. But I just want to say thank you. I'm not complaining. You're doing a great job. Thank you. And I will leave it from there. Thank you for giving me the opportunity.
Thank you, Mr. Johnson. Yeah, Dr. Zia. So he's talking about finding the opportunity to be able to explore other avenues. But you would think also that the issue of mental health, as critical as it is in Liberia, and it's the next pandemic. We just had a program. We talked about it. That the Ministry of Health would take the experts like you to go and stand before the House and say, listen, this is our major concern. And if this House don't pass bills, don't put money in the budget for mental health, you cannot run the ES Grand Hospital with 60 beds. 60 beds to 5 million people. That's preposterous. That don't make sense. There's nowhere in the world. There's no comparability in that figure. So I think there's a lot needs to be done. So I'll give the two of you the opportunity to come in. Let's start with you, Dr. Zia.
Well, I mean, the caller is absolutely right. There's a need to reach out. We know that the government may not be able, rather, to to fund most of these things in the midst of competing priorities. So yeah, there's a need to reach out. As an association, the Liberia Medical and Dental Association has been reaching out to partners abroad, and we have had some level of cordiality in cooperation and collaboration rather. So sometimes there are some of our Liberians, in the diaspora, medical practitioners, medical professionals who have been coming for outreach. And when they come, we meet, we talk. They have some of these, entities, some of these groups have made significant donations to Liberia multiple times. So yeah, there is a kind of cooperation, but again, until we can change the narrative, there is need for more cooperation and collaboration. So I think it makes sense. Yeah, LMDA is definitely open to that. And if he, as an individual, or anyone else is in the know of any group of Liberian, Liberians out there wanting to work with us here, we're more than open to that. We're more than, we'll be more than excited to work with them.
Thank you, Dr. Kulah. Your take.
Yeah, my take is that cooperation, coordination is very important. And in fact, the Kolibu Neuroscience Foundation, of which a friend of mine, Paul King, is very familiar with Liberia. They've been traveling there. In fact, they helped train Dr. Alvin Dona, who is the only neurosurgeon in Liberia, and that has been very instrumental in helping some people. And in fact, I heard that the Kolibu Neuroscience Foundation was even thinking about building a facility, a hospital that would be top notch. So it's one group that's helped a lot. I was able to take a psychiatrist to Liberia in 2010 when Grant really had nothing. At the time, we were trying to work out some modalities so that we could connect Grant with a psychiatric facility here, but that kind of fell through because, again, our people over there were not very willing to meet us halfway. And so it has to be a two-way street. Those in positions of power have to be able to work with us, and those who are in the healthcare industry have to reach out. I know the Liberian Association of Nurses and Physicians were trying to put together and try to work things out. But a lot of our people from here have been frustrated because when they go, they don't see people want to cooperate most of the times, and they get frustrated. But we'll continue to try because it's very important that we bring our healthcare delivery system up to par. Back in the day that we keep talking about when JFK was number one in West Africa, because Meharry Medical School was running JFK for the most part after USAID helped build JFK. Perhaps we can coordinate and have Morehouse School of Medicine or one of those other black HBCUs help run JFK, because the same health disparities that black people in America have, and the same things that affect them here affect our people in Liberia, whether it's the hypertension, the stroke, and so on and so forth. So that would be a good thing that we could do, and we need to look into it, and we'll keep looking into working together and coordinating.
All right, thank you. The number to call is 404-272-2808. If you're just joining us, this is Ashford Garley Live here on Bridge Radio Africa. My name is Volcano Shelton. I'm with you here, the co-host of the program. I have Dr. Ziah and Dr. Kulah. We're having a discussion. I see Dr. Ziah look frozen in from his end. I was about to ask him this important question. I will hope that he can get unfrozen. But yeah, let me come back to you, Dr. Kulah. With what is,
go ahead.
Yeah, with what Dr. Ziah did talked about regarding the ES Grand Hospital, 60 beds. Doc, you got
That's
thousands of
ridiculous.
young people who need help. Mental health is trending. Is becoming the next. We keep saying the next pandemic in the country, and yet this government continue to not pay attention. How can you have the whole country having just one psychiatric facility, and we're talking only in Monrovia, but it's not even able to serve the Pinsville population, needless to say, Montserrat County?
I mean, that's pure neglect. I mean, for a country that just came out of war, with a lot of our people suffering from post-traumatic stress disorder, you have all those sexual and gender-based violence, the rape culture, and all of that. You would think that psychiatric care, psychology, and all of that will be number one, where there will be a lot of priority put into health, restore the health, the mental health of our people. So I find it very, very, very disheartening to know that they only have 60 beds and there's not much being put into mental health. So I think all of us, Joaquin, all of us, you guys on the radio, the average Liberians, those in healthcare, all of us have to impress upon our legislators and those people in power to do something about healthcare delivery, especially mental health. We need to do that.
Dr. Zia, I work in healthcare myself, and I work in this arena we're talking about. And I know psychiatrists here in the U.S. make $78,000 biweekly. All right, and so we're talking $12,000 to $14,000 a month. Not to say that I'm going to talk about your salary, but it is important because you need to be paid well for you to be able to perform. Your skill set, your competences, qualification need to commensurate with what you get paid. We have people who have no skills lingering around in the House of Representatives, fighting for big salaries. But you people who are the bedrock of the nation's healthcare system, tell me, you don't have to call your salary. Are you being paid well? Let's be practical here tonight.
Mr. Shelton, I think you know the answer to that question.
I don't know it.
Well, truth of the matter is, it was a lot worse. To be very honest with you, it was a
Good.
lot worse in terms of compensation to healthcare workers. It was a lot worse until recently that some little addition, you know, some little addition was made to few healthcare practitioners. Now, also, when we talk about health workers in general, the doctors are at the top, but you have all these intermediaries, nurses, PAs, who play very cardinal role in the entire healthcare system. Truth of the matter is, these people make almost nothing. And even we as doctors, considering the years of study, considering your time of work, and we don't work like in the West where you have fixed hours, you're supposed to work, and after that you're gone. No, we spend up to 36 hours, 48 hours in the hospital, sometimes 72 hours, depending on where you are assigned. If you're in a rural area and you're the only doctor, you spend the entire week in the hospital. You don't leave because emergency cases are coming. Do you get paid for any of that? No. No, you make a meager income, way lower than can even sustain you as a physician. Truth of the matter is, if you endure what medical training is and you reach a certain level, you should feel comfortable. A lot of our doctors are way less than comfortable. The the fund we earn is very minimal. But again, this is the situation. This is where we are. The recent government, the current government made some improvement in topping up salaries from where they met it. But truth of the matter is, we're nowhere near where we are
But then what is
supposed.
it? What are they referring to as salary harmonization? I hear people still crying that the money keep coming down. So I'm confused here now. What? How do you reconcile the two? People saying that
Well,
they did harmonization and the salary reduced, and you're telling me they're putting a little more on yours. But even at that, do you get it often? Do you get it as the frequency of payment should be? Do you get paid by the frequency of payment?
well, let me just address the first part. So, right during the inception of this government, there was increment in the salaries of doctors.
Okay.
They became aware. They were aware because doctors have been negotiating with previous government, and we have been making a lot of pleads, a lot of pushes. We've been pushing people. We've been doing everything to increase salary. Now, the previous government did not do it, but these proposals, these efforts were all in the system. So when recent government came, they actually did improve the salaries of doctors. I wouldn't speak, to the other practitioners, but they improved doctors' salaries. Okay, their justification of harmonization was that there were disparity in people of the same qualification and same job title, but they were making this a different amount. So they were trying to make that the same. However, because of what they did, according to them, there was new tax bracket because if they were to put your salaries together, you get in the new tax bracket, and that means you pay more taxes, and all of that caused people to still experience reduction in the total income. All right, but that was the justification. I mean, I'm not a financial expert, so I wouldn't comment much on
Okay.
that. In terms of regularity of salaries, of late, it has improved because we seem to get paid monthly, especially health workers. We seem to get paid monthly, but I mean, it's not actually monthly. It will be more than a month, but most time before the middle of the next month, you get paid. There are times you actually run into the next month. So I mean, it's not a fixed system that you can be sure that, oh, I will get paid between the 25th to the 30th or between the 20th to the 25th. No, that's not the case. We have little shifts every now and then. But to be honest with you, as a physician, and I wouldn't speak for the rest of the people, as a physician, of late we have a bit of consistency.
Okay.
There are always issues, and I will tell you clearly because every now and then they do new stuff and they say, "Oh, X Y number of person names were removed from salary," and they go months. And as I speak to you, I'm in the category of people who have gone some time without being paid from the past because there were some other systems they were working on and it affected some people. So I mean, I'm just one of many people. So again, on the average, they're making effort to regularize payment, but again, it's not perfect.
Okay. Um, Dr. Kula, I was thinking about something here. Do you think it's necessary, even though he said in part JFK is almost like private, but then they get subsidies from the government? But do you think that it would be very, very helpful if we just privatize JFK, where then doctors can be paid well, where the system can be almost corrupt free, where the nurses, the equipment would be provided, and all of that? I know it's unfortunate for the user, because a lot of Liberians would not be able to afford it, but we can still put a specific fee where then people can have access to health care. But we take it away totally from the Ministry of Health, from the Liberian government, and let it just be a private hospital, probably getting, the Kennedy Foundation to come back and be aligned with some philanthropy, giving that could do that for us. Do you think that's something doable? I mean, considering Liberia.
Why don't we think about doing it this way? Why couldn't it be a public-private partnership where the government still gives its subsidies, right? And you can still train residents and other people there through TNIMA, but you have a private company that comes in and helps run JFK, in an effective and efficient way where people get proper care and set up a finance department that's different from, telling nurses that the patient go will take it from your pay, like they do here. When you go to the hospital here, you go to the ER, the doctor comes and sees you, the nurse sees you, they stabilize you. Then the people from finance come and see you, find out whether you got insurance or not. If you don't have insurance, they got people there to take care of you. It all goes to setting up our system. Once we have a system in place, I think we can do all those things properly. If we had a system of identifying our citizens, for example, if we had a single identifier system like they have here with the social security number, if we had a system that was set up to track out people, we will be able to get monies out of them instead of holding them hostage for money. I think it's something that we think about, and it's just sitting out and doing the hard work to take work. I think that's what we should do. I don't think we should just privatize where people are excluded. I don't think we should do that.
All right, Dr. Zia, I wanted to come in quick to ask you, um, do you know of any national health insurance in the country? I remembered when I was growing up prior to the war, there was Cigna, there were other, insurance companies providing medical, accidental death, motor vehicle, and all of that. Now I know the motor vehicle insurance companies in the country, but they're all there to just take your money. And when you have accident, you can't even get someone to come to the scene to represent you, and you left to yourself. But then government forces you to get insurance. I've been to Liberia several times, and I bought ship car, put insurance on the car. Trouble come, nobody
Nobody
there
does that.
to support me. But do you know from the health side? Do you know of any kind of health insurance coverage in the country?
Well, it's there's not a
Because this
general.
question is important. You being a medical doctor should be insured medically.
Yeah, yeah, true. So the thing is, at the moment, there's not any national, insurance for health for the population. Those who work with particular entities seem to have some percentage of insurance or medical insurance. And I'll give you, for example, there is a group insurance with the Ministry of Health staff that once you're working with the Ministry of Health, you have X number of dependents who can seek medical care on your bill, but there's a ceiling. All right, there's a ceiling. That means if your total bills will be in excess of a certain amount, you have to chip in something like that. But there's not a national health insurance policy in Liberia for sure. And talking about health financing, let me just make a comment right there. This is something that has affected and is affecting our people to a greater extent. There are private facilities, and Dr. Kula has been mentioning some of them. And the reason why I don't talk much about these private facilities is because the services they provide cannot be afforded by the ordinary Liberian. Nowhere near the point where they were afforded. Jamale, for example, Aspen Medical, those are more like top facilities that you have just the elite going to. So I wouldn't mention them. I wouldn't talk much about them. Those ones, because of course they're charging good fee, they're getting good money. They are obliged to improve the system because the kind of people they see, the kind of patients, the kind of clients they interact with demands them to improve. So yeah, they have investigated modalities to improve the system.
Froze again.
Yeah, it's okay. He's frozen. Um, so because that's something. Can you imagine, Dr. Kula, for us to have a 21st century nation with no national health care, rather health insurance program at any level. And now he's talking about the Ministry of Health. Same thing heard here the other day with the soldiers collecting money for their low benefits, and President Sirleaf, Brownie Samukai, all the names came out regarding how that money was misappropriated. Are we for sure that this is happening with the Ministry of Health?
That's
Tell
a
me.
good question. That's a good question. I mean, I think we need to really sit down and think hard about some of the things in our country. Like, for example, the market women, they pay table fees. Believe it or not, from what I understand, a woman pays $75 a month, if not more. So why can't those women be able to pay $10 a month towards a national health care insurance? If we really sat down and planned something like that, where all our people will have some sort of health policy where when they go to the hospital, they'll be treated and not turn away or held hostage. We have to think hard about some of those things and really work on things. I think, like I said, those of you who are on the radio and are pushing the agenda in Liberia, y'all need to push more healthcare. This is very crucial. Healthcare is very crucial. Our people are dying unnecessarily, when we could improve the healthcare delivery system for all of us.
But Dr. Kula, one of the things I've always been concerned about is why these people come to a position and they don't think outside of the box. You
Good
know,
question.
why do they come to positions? So people are not thinking of the things that are missing in the country. Oh, wait a minute, we don't have a library. A whole country. There's not a national library. I'm the Minister of Education and I'm not prioritizing that. I don't give a crap about it. I'm the Minister of Health of the country. And there's no national health care system. I mean health insurance coverage in the country. You know, what how can we continue to operate like this as a nation? I got a call on the line. Let me bring this caller in quickly, Dr. Kula. Caller, are you there? What's your name and where you calling from?
Yeah, I'm Paul, and I'm calling from. I just wanted to give my latest, and I would like to take this time to appreciate Dr. Ziah. I see you're a very young doctor, and Dr. Kulah. For my lay point, I want to bring for that Dr. Ziah was saying, when it comes to a health institution within Liberia, they are all special interests. Imagine we got a minister of health of the Republic of Liberia is controlling a private clinic. Oh my God, special interest. How can we build our health system? Trust me. It's something that we gotta really work on because we know you got doctors who work at JFK, who work at fastest health center within the country. You think he will perform well when you're at JFK? No. He will only perform well at his clinic. When they get the assistant for JFK, they take it to their private clinic and run that country. So it's a long ball game. It's a long ball game.
Thank you.
It requires every one of us to play our part. And not just, it's something that we got to start from the bottom. JFK is a hospital that we just need everybody out that we can turn over to a foundation that they can manage it well. But for that government to manage it, it's not possible.
Thank you, caller. Let me go to the line. There's another caller. Thank you.
Yeah, the whole health system is like Jabba Pass and a special interest.
All right. Thank you. Let me go to the next caller. Caller, are you there? Okay, that caller was impatient. Yeah, she's talking the same thing we're talking about. But Dr. Ziah, just before you came back, I was saying that, okay, the caller calls again. Hello, caller, are you there? Hello,
Good
caller.
morning.
Yes, caller from 0054. What's your name and where you calling from?
Yeah, it is. I'm calling for Texas. How you doing?
We're good. Welcome to the program. What's your contribution?
Yes, my contribution on the whole thing is the government. Yes, what the government is doing in our country is really bad for the citizen. Reason is, majority of the hospitals. I just came from my bureaus here. Majority of the hospital, you go in the hospital, you pay for all the services. They charge you for you to pay for. You pay for all that service, but you just sit. You maybe get any of the medication. When you say that you get like headache, they try to give you medication. You take that fake medication like for 1 week. That headache was never go. So really, the doctors, the pharmacy, the medical board, they really need to be observing the medication entering the country because some of the medication really giving side effect to our people. And our people can continue taking the same medication and the condition continue to get worse. When you take medication with Western country, you carry it there and you give it to them. For that sickness, before it's like 1 week or 2 weeks, that sickness always done. Yeah. I even stopped one of my uncle. We were taking the eye drop. He used to give me an eye drop. He said, when I took our eye drop, I bring it to America. We did test on the eye drop. And my doctor was asking who provided eye drop for the person to use. I said, back home from my country. He said, no, stop it. When you continue to use the one, they will get blind. They will not see.
Okay.
And see?
Thank you.
Yeah.
Thank
so
you.
many things happening in our country. We really need to speak on this.
Thank you. That's a whole nother topic again, Dr. Ziah. The man said the medication, sometimes they're not, valued.
Counterfeit medication.
Yeah, fake medication coming from Nigeria. I saw a documentary where the guys sit in an unfinished house and they're creating their own paracetamol and stuff right in Nigeria. And those medications come right through our borders. You know, and sorry that we brought you here. You're not the right person per se to say that you were in the arm of administration that I could ruffle your feathers here tonight. But it's unfortunate, But that was just another sad story. We'll come back to that to talk about the medication, what type of medication being provided in the country, how do these medications come in the country? Is there a pharmaceutical board that looking at these medications thoroughly through the eyes of the microscope to make sure that it's safe for our people to utilize. So that would be a whole nother ball game. We'll come to that topic sometime down the road. I will seek your help in getting the chairman of the pharmaceutical board in Liberia, to hold that discussion. But we're about to leave you guys tonight. I want you to come on board and tell me what is that one thing, Dr. Zia, that you want to see change for the medical uh, system in Liberia? What is that one important thing? Every day you go to bed, you think about it. What is it?
Truth of the matter is, too many things have to change, and that means everything has to change.
Mm.
Okay,
Hmm.
but there is one thing that I was just about to mention before I went off. Um, and we doctors, many times when we meet, we talk about it. You know, when you're a physician, your ultimate goal is to see your patient, get revived. Is to see your patient back up from the feet whenever they're down. And through all my experience working in different hospitals, and I work at Redemption Hospital, JFK, Phoebe Hospital, CP Dunbar Hospital. So I've kind of experienced it. The one thing is that we see in Liberia that public facilities are free. I think that's a political stuff. We say it is free. Previous government had that policy that it was free. Healthcare service is free. Healthcare service is not free. It
That's
cannot be
big.
free.
Right.
Somebody has to pay for it.
That's
And I
big.
know you can attest. You in the US, you know that healthcare is super expensive in America. And I had a friend of mine who went to the States recently, and she told me like she went to do an ultrasound scan, and she had to pay $1,800 to do an ultrasound scan. Do you know how much we do ultrasound for you? Free.
Mm.
We do ultrasound in Liberia free. And our JFK is $20. So the truth is, we're trying to sugarcoat this whole thing. Healthcare financing is a massive issue. So we should be thinking about revolving funds wherein people will pay some amount for service. In that way, those funds can, help government to improve. Because if the government say it is free and we agree that it is free, but then when you go to the emergency room, you realize that, for example, in CB Dumba, in Phoebe Hospital, okay, everyone is aware that they're not supposed to pay money, but they come to the facility
Mm.
and basic life-saving drugs are now available at 2 a.m. The pharmacies they're supposed to go to buy the drugs, the pharmacies are closed. The hospital does not have the drug, nowhere for them to get the drug. The drug is needed immediately for the doctor to save a young child's life. But then we say the service is free. And because of that, that young child or that pregnant mother or that father of many children or that mother of many would die right in the hands of the doctors when they know what they're supposed to do, but they have no tools to do it. These things break our heart, honestly. So instead of us saying it is free of charge, go to the hospital, let people know that they're supposed to pay so that the hospital administrations can ensure that these life-saving drugs are never run out of the facility. I mean, we can go on and on and on saying a lot, but like I said, I'm not trying to quote it. I'm not trying to make it look beautiful. But I will tell you clearly, prior to the onset of postgraduate medical education in Liberia, and at at the time, current day, several years down the road, I can tell you that there have been some improvement. The improvement have been minimal. It's been not satisfactory at all, but there have been some improvement. In particularly in era of workforce, health workforce, we now have several specialist doctors in Liberia. But it will break your heart to know that a specialist doctor who is trained in Liberia is sent to the hinterland, to Foya, to Zozo, to Vonjama, and they cannot even run a simple HB test for a patient because no
Yeah.
machine, no current,
You said
no
the man
this,
named
no that.
Tira.
Nothing.
He can't do
Yeah.
anything. I mean, you send him to become disabled. He gets trained, he gets the knowledge, he has the expertise, but he goes to the hospital and the hospital cannot even do the simple HB test.
All right. He's frozen again.
They're
That
practicing with their hands
yeah,
tied
yeah,
behind
that
their
was a
backs
very
in some
important point he
instances.
made.
Most
So
of them,
Dr.
but then you
Kula,
expect the system.
okay, he's trying to. All right, Dr. Kula,
Well, that's it. That's it. Thank you so much. I think I will just close right there. We can go on and on talking about the problems,
yeah,
but we should acknowledge that we improved to some extent, but there's more to do.
thank you very much, Dr.
Thank you.
Zia. Thank you. Very valid point. Sending somebody in the interior to go work who is a medical doctor, where he's going, that he's gonna go work with candle or lantern or jack o' lantern. You know, yeah, that's interesting. Dr. Kula, before we take leave of you, what is that one important thing you want to see change in the healthcare system of Liberia?
There's so much,
I know
Doctor
that you see.
Doctor
You
Zia
know
has
what? The reason why I ask this
that
question is the same thing. The president come to power, they want to do everything instead of taking
everything.
one
But what's
important
that
thing and
one
do it
thing?
well. If I
Right.
were to be a president and I came here and say, listen, healthcare will be my priority number one. All other things y'all can wait for the next leadership, and I do it well. I leave a legacy. But you want to be
That's
jumping
right.
here, there, and yonder, and you
Right.
can't do everything. So I'm
But let me,
asking you that one thing that I've been
yeah.
burning.
Let,
Yeah.
let me just say that one thing for me would be to focus on priority area. Let's say, for example, look at the data. What are people dying from mostly? And just put your resources into making sure that our people are saved and not dying from that. If it's stroke, let's put our resources into making sure that we manage our people, high blood pressure in an optimal way, and not get them to that point of a stroke. But I think for me, the one thing would be to have a great urgent care or ER at JFK, which is equivalent to one in the United States, so that anybody that comes in an emergency situation can be saved. I think that would be the one thing for me.
Thank you. That's brilliant. You see, so at least we know there's something that is of significance to you. But gentlemen, thank you so much, Dr. Zia. I appreciate it. You finding time to come on the show tonight. To be here with us. I know you look sleepy. You got to get up in the morning to get on your everyday routine, or maybe you might not sleep. Your phone will be buzzing because you got to handle emergency situation. Dr. Kula, sorry for inconveniencing you for about an hour and a half sitting in your car because you were on the
That's
road and
all
you
right.
decided to pull over. I hope you're in a safe area. But thank you
I
guys so
am.
much. I owe gratitude to you. Ashford does the same, and Bridge Radio family. We will bring you guys back in the not too distant future to talk about some of the other things when we talk about medication. What type of medication coming in our country, and is it really helping our people or is it killing them further? you know, so it's not just misdiagnosis. Now you misdiagnose the man, but then you also giving him the wrong drug, and here it becomes fatal. So thanks, gentlemen. I appreciate the time. Thank you so much. Thank you.
Thanks for having us.
So that's it, ladies and gentlemen. We want to thank you all for being there with us tonight here on Ashford Garden Live. You know, great discussion. I'm sorry my man Ashford couldn't be here tonight, but we'll be back here on Wednesday again with another edition. We have another important topic to discuss. Um, and I tell you honestly, we'll continue to enlighten our people. We'll continue to bring about the important events in the country, the things that are of significance to the viability of Liberia, and to create a a healthy society, an educated society, where the socioeconomic status of our people can improve, rather than have only few people enjoying what the greater country should be enjoying. But in the meantime, we want to thank all of you, our viewers, Bill Bonkar, Joe Williams, Caroline Wallo, Agnes Sambukai Moba, Isa Kofa. We also want to salute Fimin Adams, Pro Poor King, Helen Brown, Thomas Awaji, um, Nay Ajay, all you folks for coming on tonight. We say thank you so much. I'm Volcano Shelton. We'll be back here on Wednesday, 8 p.m. We'll go back to our usual time. here on Ashford Garley Live Reach Radio Africa. Thank you, folks. See you.